The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacies. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health System. Today, pharmacist Brad White and I are broadcasting from administrative offices, and our guest is Dr. Sabrina Shelad. Did I say that right, Doctor?
You did. Yes, Shelad. Very good.
Shelad, very good. Fellowship trained breast surgeon with Altman Breast Care Center. Good morning and welcome to the show, Doctor.
Good morning. Thanks so much for having me this morning.
Breast cancer is the most frequently diagnosed cancer in our community and the nation. Altman Breast Care Center is the first Stark County facility to earn the Center of Excellence, a designation from the American College of Radiology. We'd like to remind our listeners that our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So you're up, Brad, I think.
Okay, well, Doctor, why don't you tell us a little bit about yourself and your career as a surgeon?
Oh, thank you. So I guess I was a general trained surgeon. So I did general surgery for many, many years. So general and trauma, and I came to Canton in 2010. And at that time I was doing trauma surgery, general surgery, a little bit of everything. And then I started focusing on breast surgery and the people in the community with breast cancer. So I actually then went up to the Cleveland Clinic. I did a additional year of fellowship, so a year of training in breast surgical oncology. And then I came back down to Altman, and I've been there ever since, focusing on women with breast cancer. And then I stopped doing the other general surgery, the general and the trauma, and just now focus on breast issues. So breast cancer, breast problems, all the things involved with the care of women and men with breast cancer.
So what is a fellowship trained breast surgeon?
So a fellowship trained breast surgeon is a surgeon who has done extra additional focus training in taking care of people with breast cancer. And what the fellowship does is they call it a multidisciplinary fellowship because so as a surgeon, I have my little land of surgery, but breast cancer is not in an island. It's not just the surgeon. And so one of the really cool things about the fellowship was that I spent time with the medical oncologist, the radiation oncologist, even the pathologist, the radiologist. So all the different specialties. I mean, I spent a few months with our plastic surgeons up there. And it's great because it really teaches you what are all the other subspecialties doing in taking care of breast cancer. So that way it lets you really understand and know what everyone else on your team is doing and what approaches they have.
So at what age should you begin mammogram screenings?
So we tell most of our patients to begin screening mammograms at the age of 40. And that's just sort of across the board. Now, there are some exceptions to that. And so those are women who have, for example, a family history of breast cancer. And so if there's a family history of breast cancer, we encourage women to start their mammograms 10 years before they're the youngest relative. So if they had a relative who was diagnosed with breast cancer at the age of 42, we'd recommend they start getting their screening mammograms at 32.
Jeez.
Yeah.
So how often should a mammogram be done?
Usually once a year. And so usually one screening mammogram once a year. Now, sometimes women need a mammogram more frequently. Sometimes it's every 6 months, but that's usually only if the radiologist is looking for a specific thing. So if a woman has a screening mammogram and the radiologist sees something that's not entirely normal, but also not horrible, that's just a little bit different. Sometimes they get extra views with mammograms and ultrasounds, and then they say, come back in 6 months and let's repeat the imaging. And so sometimes women do mammograms every 6 months for a couple of years, just so that way the radiologist has a chance to sort of look at that little area that stood out and make sure that it's stable and nothing's changing.
Okay, so you covered who should get a mammogram earlier than
Yeah.
40. What about high risk screenings? Kind of, does that go along with what your repeat tests are talking about, or is that something different?
That's something a little bit different. So high risk screening is looking at women who have risk factors, who are at a higher risk of developing breast cancer. So for us, women who are at a higher risk of developing breast cancer, it means that their lifetime risk is over 20%. And so those women we watch closer, and that's usually with mammograms and MRIs. And then we'd like to alternate those every 6 months. So that way those women are getting some kind of imaging every 6 months, whether it's a mammogram and then 6 months later an MRI. And sometimes we start those a little bit earlier, even with family histories, but also if women sometimes have a gene that works not quite right. So Angelina Jolie is the most sort of popular example of that. And so the women who have the same kind of gene that works not quite right as Angelina Jolie, a lot of times we see them even sooner, even without a cancer diagnosis, of seeing them then with mammograms and MRIs.
So what does it mean if a mammogram finds something?
So a lot of times it's just that there's a little something that's not quite right. And so it's a mammogram that shows up as needing extra work. A lot of times our radiologist first does an additional view of a mammogram. I call them the extra squeeze views, because they are usually a little bit more compression, a little bit more sort of focus on an area. But sometimes they also do an ultrasound. And so these other tests that they're doing, they're looking to see what's going on. Is this something we need to worry about? Is this not something we need to worry about? And more times than not, it's not something we need to worry about. And so it's one of those things where our radiologists, they're very sensitive to looking for subtle changes. And a lot of times those subtle changes are not something you need to panic about, but it is something that the radiologist needs to look at further.
So what does the Tyrer-Cuzick score and the mammogram report mean?
Oh, so that's a great question. So the Tyrer-Cuzick score is a risk assessment score that frequently shows up on the bottom of a woman's mammogram. And what that does is it takes into account all of their potential risk factors. And so it looks at all of those things, and then it calculates a lifetime risk of developing breast cancer. And so over 20% is that high risk, 15 to 20% is intermediate risk, and then less than 15% we usually consider just average risk, with our average being about 12, 13%. And so things that go into that Tyrer-Cuzick score, when a woman goes and gets their mammogram, frequently the tech will ask them questions about when they first started having periods, when they had baby, any family history, prior biopsies. All those things get entered into this risk calculator, that Tyrer-Cuzick risk calculator. And that's what helps generate that score to help determine if someone is high risk or not.
Well, okay. Does getting a vaccine affect your mammogram results? Would you notice any breast changes after a vaccine?
So not necessarily breast changes, but a lot of times when they do a mammogram, they are able to see some of the lymph nodes. So especially right when people started getting vaccinated, especially for the COVID vaccine, they did notice that they could see some of those lymph nodes be a little bit more prominent on the mammogram. And so for a short period of time, our radiologists were a little bit more cautious and paying closer attention to time of vaccination to when they get their mammogram. At this point, they've pretty much, all of that has sort of settled down as everyone's immune systems have sort of also regulated.
It's time for our first break, Doctor. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you tired of paying hundreds of dollars to find out your thyroid, A1C, cholesterol, and vitamin levels? You don't have to anymore. Schedule your low-cost lab test at the Medicine Center Pharmacy. You can get your A1C, thyroid, and vitamin D lipid profile, which includes your cholesterol levels as well as glucose results. Test results in just minutes, and you can share them with your provider. Call the pharmacy or schedule online at MedShopRx.com. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
This is Paul White from the Medicine Center Pharmacy. We have a fantastic deal for you just in time for flu season. Pick any 2 Quality Choice brand cough and cold items and get 50% off the lower priced item. Also, at the Half Off and Out By store, we are all set for Valentine's and Easter. We're thinking ahead for warmer weather, so stop in and take advantage of these great deals here at the Medicine Center Pharmacies and the Half Off and Out By store.
Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, MedShopRx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
1480 WHBC.
Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for the vaccine season? Well, we're already in it big time. Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at MedShopRx.com.
All right, doctor. How long should a woman continue to get a mammogram?
Oh, so we tell our patients to get a mammogram every year until it gets to the point where their health seems to be deteriorating and life expectancy is 10 years or less. Now, some national places say, stop at 70, stop at 75. There's a lot of really active, spry women still at 70 and 75. So we still encourage women, as long as they're being active, doing all the things, and they'd be interested in some kind of treatment, to still get your mammogram. And the reason we do that is that what screening mammograms do is it helps us find breast cancers that are really small. And so without a screening mammogram, unfortunately, what happens is some of our older patients, they wait until they can feel a mass. And now they're older, and then they have this great big mass that they still want to do something for, but they weren't getting a mammogram because they thought they should have stopped. So we always tell our patients, as long as you're active, spry, doing all the things, please go get your mammogram, because it can change something from being a really small little surgery to take care of a cancer, from not being a big surgery.
Gosh.
Okay. What do you say to someone who tells you they don't need to be checked because they don't have any family history of breast cancer?
Oh, I say, please still go get your mammogram. And the reason we do that is that it's 1 in 8 women get breast cancer now, and that's without any family history, which is a lot of women with no family history who are still getting breast cancer. So even if there's no family history, we still encourage everyone to please go get a mammogram, because it really does help us find breast cancers that are small and much more easily treatable.
Wow. So, who should consider genetic testing?
So a lot of times we have 2 groups of women that should have genetic testing. And so that first group of women is women who have had breast cancer. Now, there's specific factors that we look at. And so we look at age of diagnosis. At that point, we do bring family history into play. But we also look at the type of cancer. Now, there are some studies that recommend everyone who has breast cancer should have genetic testing, but unfortunately, that's not something that, unfortunately, a lot of insurance companies will support. So our national NCCN guidelines do have pretty strict criteria, which are looking at family history, age of diagnosis, cancer type. And those are the women that we generally test. Now, there's a lot of genetic testing companies out there that, even if your insurance company isn't going to cover it, they tend to work really well with our patients, in helping to cover the cost of genetic testing. So that's sort of the first group of women who have a breast cancer diagnosis. And then our next group of women is women who don't have a cancer diagnosis, but who do have a significant family history of, sometimes it's ovarian cancer, certain types of breast cancer, and even certain types of prostate cancer. There are a couple of families that we help take care of that we found them because dad had prostate cancer, and then their daughters, dad's siblings, end up getting genetic testing because dad had really bad prostate cancer. And it's also very specific. Now, prostate cancer, I don't, of course, treat. I'm a breast surgeon. But the criteria is very specific, and our doctors in the community are great. So of all the guys that have prostate cancer, they know, hey, these are the guys we need to test for genetic counseling, and then talking to their families about genetic counseling for them.
Jeez. Okay. When should you do a self-exam, and what things are you looking for?
So I tell women that they need to be aware of their breasts. Oh, it's not necessarily, do an exam on the first of every month, but just sort of being conscious and aware of changes in your breast, and realize that the breasts right and left, I mean, it's a great sort of set of symmetry. So if one breast starts feeling different than the other, like, bring that to your doctor's attention next time you see them. But you're looking for skin changes, discharge, lumps, bumps, anything that's different that you're noticing, definitely let one of the doctors on your team know that, hey, this breast is different. And for our guys, it's really the same thing because we do know men can get breast cancer and it's the same.
Hmm.
If they're noticing lump, bump, discharge, something that's different, then they also need to be telling their doctors and their care teams that, hey, something's different here.
Okay. Should you receive additional screening if you have dense breast tissue?
So it depends on how dense the breast tissue is. So there's sort of a spectrum of dense breast tissue. And so one of the great sort of additional screenings that we do, it's sort of built into women's screening mammograms nowadays. So initially, when women would get a screening mammogram, it would just be two pictures. So one squeezing the breast top to bottom and the other squeezing the breast side to side. Now, our radiologists, when they do a mammogram, they frequently do something called a tomosynthesis or a 3D mammogram. And what that does is instead of just taking those two pictures, it actually takes hundreds of little pictures when women get their mammogram. And so women with dense breast tissue, they're already sort of getting that extra modality that's already built in. And we've been doing that routinely, I'd say, gosh, for at least maybe 10 years. And that's just built into when you go get a mammogram, you're getting all those extra pictures. Some of our women with extremely dense breast tissue, sometimes they get an MRI as well. And there's very sort of strict criteria on who really benefits from an MRI for dense breast tissue. Is it really helpful and beneficial? And there's sort of standard MRIs that we use for our high-risk patients. And then we also have what's called an abbreviated or a fast MRI. And that is something that does help some of our patients who have extremely dense breast tissue to help sort of see what else is going on in the breast.
You know, with all the talk of imaging, I think it would be wise to touch on the fear or what, you know, sometimes there's a lot of scrutiny about imaging. You know, is it too much radiation? Is it going to cause cancer? Can you speak to what we know scientifically about safety risks with respect to imaging?
So I think one of our radiologists once told me that the amount of radiation that a woman gets from getting a mammogram is the same amount as a plane ride from here to Florida. And it's about the same amount of radiation that you get walking around outside for, I think it was a few weeks. And so it's not this huge amount of radiation. And it really is pretty minimal, the amount of radiation that women get from mammograms.
I'm going to guess that the radiation used in imaging today is less than it was 20 years ago.
Oh, absolutely. That's such a great question. Imaging technology has changed so much in the last 15, 20, 40 years. I mean, so much has improved with the way that they do the imaging and sort of the way that all of that is set up. So yes, absolutely.
Okay. So how about this? Is breast cancer on the rise?
Oh, it is. It's unfortunately on the rise. They're seeing it more on the rise in actually women under the age of 50. Now, it hasn't been a huge bump, but it has been just a slight increase that they've noticed over the last few years that women under 50 age group had a slight uptake in their breast cancer diagnosis rates.
All right. What about factors that increase the risk of developing breast cancer?
So as far as, things that increase risk, so it has a lot to do with overall health, weight, exercise, other things that women don't have control of. Unfortunately, it's family history. But It can be things like when you start having your periods and cycles, when menopause starts, when you have babies, and a lot of these factors are not things that women can control, but they are things that play into the overall things, overall risks. Breastfeeding is one of those things that can lower the risk slightly. And so all those things come into play when it comes to the risks associated with breast cancer. One of the other things that we see is there's a certain change that women can have in their breasts. They're called atypical cells, and we can see those on biopsies. And women who have atypical cells, again, something they can't control at all, can increase the risk of them developing breast cancer.
You mentioned,
Time.
oh, I'm sorry. Go ahead, Brad.
It's time for the news.
Oh, a little early, huh? Okay. It's the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
WHBC AM Canton, reliable as ever, powered by Friends and Family Credit Union. It's time to bring a friend into the family on News Talk 1480 WHBC.
From News Talk 1480 WHBC, cold weather advisory in effect now through 7 a.m. tomorrow. Winter storm warning starting at 7 p.m. tomorrow, continuing all the way through 10 a.m. Monday and through 12 noon on Monday for Carroll and Tuscarawas counties, expecting 4 to 8 inches of snow overall from this event. 2 people dead in an apparent murder-suicide yesterday at the Oroville Municipal Power Plant. An employee of the plant was killed. Then Channel 3 says 46-year-old Robert Simon turned the gun on himself. The employee died at the hospital. The Illinois doctor accused of killing his Columbus ex-wife and her new husband to be arraigned on aggravated murder charges this afternoon. 39-year-old Michael McKee arrived at a downtown Columbus jail on Tuesday after being extradited from Rockford, Illinois. He faces 4 aggravated murder counts for the December 30th shooting deaths of 39-year-old Monique and 37-year-old dentist Dr. Spencer Tepe. And U.S. Senator from Ohio Bernie Moreno wants to place a full social media ban on children. The Republican proposing an under-18 ban on all social media sites during a Senate committee hearing, calling TikTok and such worse than cigarettes for this generation. Legislation has been introduced proposing an under-13 ban. Your next news at the top of the hour when it breaks. Jim Michaels, WHBC News.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy have locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com.
This is Paul White from the Medicine Center Pharmacy. We have a fantastic deal for you just in time for flu season. Pick any 2 quality choice brand cough and cold items and get 50% off the lower priced item. Also, at the Half Off and Hot Buy store, we are all set for Valentine's and Easter. We're thinking ahead for warmer weather, so stop in and take advantage of these great deals. here at the Medicine Center Pharmacies and the Half Off and Not Buy store.
Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
Your severe weather station. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Today will be cloudy, brisk, and bitterly cold with a high of 17. Tonight, expect partly cloudy skies and frigid conditions. The cold air will be life-threatening with a low of 4 below zero. Tomorrow will bring a thick cloud cover and continued bitter cold. Prolonged exposure outside could result in hypothermia, and unprotected pipes may freeze. The high will reach 10. Tomorrow night will be frigid with periods of snow accumulating 1 to 2 inches and a low of 8. Sunday will remain frigid with 1 to 3 inches of snow expected and a high of 19. With the AccuWeather forecast, I'm meteorologist Joe Lundberg for News Talk 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Dr. Shalad.
All right, doctor, what can we do to reduce the risk of breast cancer?
Okay, so there's some relatively simple things to do. I say that a little bit tongue in cheek because one of the best things we can do is exercise. And so what everyone always says about heart health, good cardiovascular, 30 minutes of walking a day, that works to reduce cancer risk as well. And again, tongue in cheek, because sometimes life can get a little crazy. It's hard to exercise and find time to do that. But really, exercise, staying active, cardiovascular health really helps overall body health as well. So being active, eating good, healthy foods, avoiding processed foods. Lots of people talk about a Mediterranean diet, so high in legumes like chickpeas, lentils, and good, healthy fruit and vegetables. I mean, it's eating all the good stuff. And then I tell our patients who are diagnosed with cancer that you want to avoid what we call high glycemic foods. So those are, again, I have a sweet tooth, so it's the yummy foods. It's the donuts, cookies, cake, all those things that make your blood sugar go high. I mean, those not good with a cancer diagnosis as well. So good, healthy foods, fruit and vegetables, exercising. Those are some of the biggest things people can do, maintaining a healthy weight, staying active. So all those things go into helping to lower the risk.
How about coffee and tea?
I haven't seen any studies about coffee and tea associated with breast cancer or lowering risk of breast cancer. But
Okay.
I haven't heard anything bad about it either.
Oh, there's a lot of coffee being consumed in America and everywhere else.
Yes.
I love coffee myself. So
And I think the coffee part's okay. I think the part that gets us into trouble is the half a cup of sugar and all that cream that goes with our coffee.
yes, okay, okay. So, do men need to be concerned about breast cancer? We're tested for everything, and
I guess concerned is, I wouldn't say concerned, but I would say they need to be aware that it's a possibility. Because what we don't want is a guy to feel a lump and be like, oh, there's no way that I could have breast cancer because I'm a guy. So men can develop breast cancer. Is a very small percentage of men. So it's usually of every 100 breast cancer patients, about 1 or 2 of them, usually 1, statistically speaking, is a man. So it is a very small percentage, but it does still happen. And so it's not, the 1 in 8 that women are, but it is enough that men do need to know that if they feel a lump, that they really should let their doctor know. And the workup for men is the same. It's a mammogram and an ultrasound, and it's looking to see, is this something that we need to worry about? And now, most of the time, if men feel a lump, it's usually gynecomastia. which is a non-cancerous, sometimes painful lump that men can have behind the nipple and areola. And we can see the difference between gynecomastia and a cancer on mammogram imaging.
So what's the first thing you should do if you find a lump?
Tell your doctors, tell your care team, let them know that you feel a lump. And then at that point, if people are over the age of 30, then they get a mammogram and an ultrasound, not just one or the other. We always want to do both. And so mammogram and ultrasound if you feel a lump. And I guess the step before that, if you feel a lump, is to take a deep breath and not to panic. So let's do that first. Because
Okay.
more times than not, it really is going to be nothing. But
Now, doctor, that's not a very good diagnosis.
Yeah.
By the individual that has it. Okay.
But again, so take a deep breath, be like, okay, we're going to do this, but definitely after you take your big deep breath, don't panic, call your doctor and say, hey, I feel a lump. Let's look at this.
Okay, so that's the first thing you should do, huh?
Yeah.
How common is it in men?
So let's see, I feel like it's maybe like, so it's 1 in 100 breast cancers. So I feel like it was like 1 in 2,000 men. Let me look. So yeah, it's about 1 in 1,000 breast cancer cases are in men. So it is pretty darn uncommon.
Does the insurance companies balk at somebody, a man who wants, or they want to do a breast cancer screening?
That's a very good question. So not if they're having a problem. And so whenever a man has a problem, we do what we call a diagnostic mammogram. And so a diagnostic mammogram, insurances cover, but cover as far as it goes towards that darn deductible. And so screening for men and breast cancer is not free and covered the way it is for women, because for most men, if they're getting a mammogram, it's not for screening, it's for a diagnostic workup. And it's interesting from the wording standpoint. So in the land of imaging, there's screening, which is we're not having any problems, we're just making sure that everything is okay, versus diagnostic, meaning we want to do more of a workup. And so frequently men do not get screening mammograms, but it's usually a diagnostic workup mammogram.
Okay. So what should you do if your provider tells you you're too young for it, the breast cancer?
Come call me. Call me at the breast center. So I always tell people, unfortunately, there's no such thing as too young for developing breast cancer. I think it is common in women, we know. It is uncommon in young women, though. But young women can develop breast cancer. So if a young woman feels a mass, so in young, I'm saying less than 30. So if someone under the age of 30 feels a mass, we usually start with an ultrasound first. And so we look at that mass with an ultrasound and we look to see. Now, young women make lots of lumps and bumps in their breasts, and more times than not, it's a non-cancerous lump called a fibroadenoma. And so we want to make sure that's a fibroadenoma and nothing more concerning, because we do know, although it's not very common, it can happen that young women can develop breast cancer. So first step is we do an ultrasound and we look at it. And breast cancers look different in ultrasound imaging than those non-cancerous fibroadenomas. One of the other sort of painful lumps and bumps that young women can get in their breasts are called cysts. And so cysts are also non-cancerous, and they again have a very different and distinct appearance on that imaging than a cancer. So we still always want to look and see What does it look like? Is this something we need to worry about? Or is this something we can say, this is really okay?
Okay, very interesting.
Yeah.
So we've talked about a number of different things. Have we talked about common surgical options for breast cancer? Does one provide a better outcome than another?
So from a statistics and outcome standpoint, so they're essentially the same. So the two main options that we have for taking care of women with breast cancer, one is called a lumpectomy. And a lumpectomy is where we remove part of the breast with a bit of healthy tissue in every direction around it. Lumpectomies frequently go hand in hand with radiation, so that way the whole breast is getting treated one way or the other. The other surgical option is a mastectomy, and a mastectomy removes the entire breast. And some women, when we do a mastectomy, we make them as flat as we can make them. Now, women do have the option when we do a mastectomy to work with one of our plastic surgeons to rebuild the breast shape and mound. And frequently we do those surgeries together. So I start the surgery, I remove the breast tissue, the plastic surgeon then comes in and then they rebuild the breast shape and mound. So that way women wake up from surgery still having the aesthetic appearance of a breast shape and mound.
I imagine that, psychologically, it's got to be a lot to deal with. So I'm imagining that at least if you have that reconstruction, it helps a little bit, but I can't speak, but I'm just thinking how waking up and, like you just said, and seeing your body look so different, it's got to be an emotional trauma.
It is. And and so when we tell women who do reconstruction, we're just like, listen, like they tend to look really good. But it's usually then not as good as the original. But it is still a lot better. Now, some of our women who choose not to get reconstruction, it is a process for some of those women to be able for us to take off the bandages and look down and see that they don't have breasts, because it is different. I mean, they've spent their entire life with breasts, and sometimes they wake up with surgery having one breast, having no breasts. It is a different look. In some women, and it's very much an independent thing, because some women, like, they don't need their breasts, and other women, it is a huge part of how they identified themselves. And so it is one of those things that helps a lot. Now, one of the newer techniques that we've been doing for the last several years is something called a nipple sparing mastectomy. And so we preserve the nipple and the areola. So all of that, or a majority of that skin, is still there. So that way, when women wake up from surgery, it's not the Barbie look anymore, but they still have nipples and areolas and that shape that's much more closer to normal. And that being said, some of our women look fantastic. Like, you look at them and they're just like, oh my goodness, like, that's not a real breast. And it's a full spectrum, and everyone's a little bit different. Some women, they're just like, yeah, we're really happy with this. It's different, but it's still good. And other women are just like, you can't tell. So every woman is a little bit different. And we're really fortunate. We have such great plastic surgeons that we work with that have all these very transparent, honest conversations, and they work really hard to set realistic expectations of, like, this is what things are going to look like.
Hold on a minute.
Going into it, they know what they're doing.
Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple, easy way to save money at your local Medicine Center pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy, with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at MedShopRx.com.
This is Paul White from the Medicine Center Pharmacy. We have a fantastic deal for you just in time for flu season. Pick any 2 Quality Choice brand cough and cold items and get 50% off the lower priced item. Also, at the Half Off and Hot Buy store, we are all set for Valentine's and Easter. We're thinking ahead for warmer weather. So stop in and take advantage of these great deals here at the Medicine Center Pharmacies and the Half Off and Not Buy store.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Not Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Not Buy store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
1480 WHBC.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show.
All right, doctor, do women with breast cancer always need radiation and chemotherapy?
No. So it's one of those things where women have very tailored treatment options. And so we really try to sort of treat the patient, and it's not just a cookie cutter approach that everyone gets the same thing. So frequently women who get lumpectomies, they usually do get radiation. But in women over the age of 65 or 70, sometimes that radiation is abridged, so shortened. So instead of getting 3 to 4 weeks of radiation, sometimes they only get 5 treatments total spread out over a couple of weeks. Sometimes they don't get radiation at all. And really our radiation doctors sort of look at the overall picture and see, do you really need radiation? Now, I like to think of cancer treatment as being in 2 big boxes. So my first big box is what we call local therapy. So local therapy are things that we're doing to the breast directly. So that's surgery and radiation. And then that next big box is systemic therapy, things that our medical oncologists do to treat the whole body. Now, that's where chemotherapy comes into play. So we don't always need to treat the whole body with chemotherapy. It depends on lots of things, but a lot of it comes down to sort of the biology of the cancer. Is the biology of the cancer aggressive enough to warrant treating the whole body with chemotherapy? And that's one of the big things that our medical oncologists look at, is what's really going to be best for the whole body.
Are breast skin lesions concerning?
They can be. Now, the skin's largest organ of the body, and so there's skin on the breast. And so sometimes those skin lesions are just the regular moles, lumps, and subtle changes, cysts that are everywhere on the skin. They just happen to be on the skin of the breast. Sometimes breast skin lesions can be something much more serious. It can be a sign of an underlying cancer or something else going on. So if there is something going on, definitely let your doctor, let your care teams know that you notice a skin lesion on your breast and have someone check it out.
Once diagnosed with breast cancer, what is the next best step?
So with a cancer diagnosis, there's lots of things that go into it. So first is going to be meeting with people that are used to taking care of breast cancer. So we're pretty fortunate. We have a full team. And so there's a whole village at our breast program that helps take care of women with breast cancer. So frequently what happens is that cancer diagnosis, it's made frequently after a radiology does a biopsy. And so there's a team there that walks people through the process of getting that biopsy. After that biopsy, then that little piece of tissue that they biopsy gets sent up to the pathologist. And so they look at it, they see that's a cancer, and then they send patients to either a breast surgeon or medical oncologist to talk next about what do we really need to do next. Is this something that we can treat with surgery first? Do we need chemotherapy first? Do we need to do something else to help with the workup for this? And then we go from there, just one step at a time of what's going to be the next best step. Who do we need to meet with next? And where do we need to go?
Okay. What is the benefit of going to a breast center, and tell us what makes Altman Breast Care Center so special?
Well, one thing that's great about our breast center, and really sort of the breast program at the hospital, is it's a full village. And so for myself, so there's myself and my office staff, and they're used to dealing with women who have breast cancer. And we have a real small group, but they're really sort of on it and they know what they're doing. And then one thing I love about what I do is I'm so connected to all these other departments. And so there's really not a day goes by that I don't talk to our radiologist and our pathologist. And then we have our medical oncologist. There's a full team. We have a radiation oncologist that focuses on breast cancer. And then when you come to our hospital, we have teams in the OR that help take care of our breast patients. And it's just this full team of people. So there's clinical trials. And so we're always sort of looking to see what's going to be the best thing that we can do to help take care of this patient. There's therapy people in case women develop lymphedema after surgery. And it's interesting. So there's actually, so the hospital has something called a breast program leadership, BPL. And we meet 4 times a year. We look at national standards, and it's all about making sure that women get the best possible care that they can. And there's accreditation statuses and there's sort of like that part that goes with it, but really it's making sure that women are really getting the best possible care. Part of that is working with the genetics department. It's the plastic surgeons that we work with. I mean, there's so many different parts. It really is. It's not just a one-person island. It's this whole community and village taking care of each person. So our breast cancer program, they have their own dedicated navigator. And so this woman is a nurse that knows all of our breast cancer patients, and she helps them with all the things that are going on with life, because life still happens when a woman gets diagnosed with breast cancer. Like there's still bills to pay and kids to pick up or parents to take care of. Like there's all these things, and it can be pretty overwhelming. And it's nice that we have this little community that if women don't have good support, we can say, hey, we have this support for you. Let us help you.
So, Dr. Shalad, any further information about the Altman Breast Care Center to share?
I mean, I guess if there's problems, questions, always give us a call. I mean, it's pretty nice that we have a good program, and you can call us up and say, hey, I feel something and let's get this taken care of. Now, one thing that's a little bit different is that so we have our breast center, which is this fantastic, beautiful imaging center. And then the breast surgery office is sort of lives within it. And so if you call the breast center looking for me, you won't find me. But it's one of those things where we all work together. And so it's nice to be able to sort of have that little community.
Interesting.
Yeah.
Well, thank you, doctor, very much. Altman Breast Care Center. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.
The preceding program.
Thank you, Doctor. Appreciate
Yes,
you.
thank you very much.
Oh, you're welcome. I hope
Okay.
we got everything